Hi, in today's video, we'll be discussing about reticulocyte counting. What are reticulocytes? Reticulocytes are immature red blood cells. They are called reticulocytes because of a mesh-like remnants of RNA present in them. So the key word in the definition is immature red blood cells. How are these reticulocytes stained? They are stained by supravital stains. Which are the supravital stains? We have brilliant crescite blue, azure blue, and new methylene blue. Between these three, new methylene blue is known to be better than brilliant crescite blue. Azure B stain is also used. The important thing about reticulocytes is that they should be stained on vitally stained unfixed preparation. That is the key word here. Means you cannot do the staining on a slide. It has to be done on live cells. So what we do is, the method of preparation is, we mix equal volume of blood with the reticulocytes, right? And then we allow it to incubate for 10 minutes at 37 degrees. Now the quantity of blood that you will take for the suspension varies upon the hemoglobin concentration. Let's say there is anemia. In case of anemia, you will have to take more quantity of blood. On the contrary, if it is a polycythemia, you will take less quantity of blood and more quantity of the stain. Now how do you visualize it? We visualize it under, this is how a stain preparation will look. And we have here a lot of reticulocytes here. The cytoplasm will take up a greenish blue tinge, and these are the reticulocytes. What you can see here is the reticulocyte with a delicate network of RNA, which is visualized here as the reticulum. Right. So how will you count them? So you have to count under oil immersion, and you will have to count at least 1000 RBCs. To count 1000 RBCs is quite difficult task, isn't it? So we can make a rough estimate. What we can do is, we can count the number of RBCs in one field, make an estimate, and then let's say in one field I get around 100 RBCs, then I count 10 oil immersion fields to make it up for 1000 RBCs. That is one way to do. The other way is to do by a Miller's ocular lens. So in a Miller's ocular lens, this is the Miller's ocular lens here, you can see here, right? So what we have here is that it's like a insertion. In the eyepiece, you will insert this paper, and 1/9 of the dimension of the field is covered in the small box. So what you will do is, you will count the number of RBCs in the small box, but you will make the counting of reticulocytes in the entire field. So this will give you an idea that 1/9 of the square contains RBCs, let's say 10 RBCs, so my entire field contains into 90 RBCs. That's how you will calculate. Next, I will tell you how to identify a reticulocyte. To quantify as a reticulocyte, a cell should have a minimum of 2 bluish dots, and the dots should be away from the cell membrane. Alright, and they should be away from the cell membrane. Why? Because Heinz bodies, which are remnants of DNA, as we can see here, Heinz bodies, they have a single bluish dot at the periphery of the, you can see here, periphery of the membrane. So reticulocyte, at least 2 dots should be visible to differentiate from Heinz bodies. The other criteria, or the other thing you should rule out, is a HBH inclusion. HBH inclusions, they resemble golf ball inclusions, right? So they are quite distinct from the reticulocyte. You should not confuse these preparation for HBH inclusion, right? The third is Papenheimer bodies. In case you have a confusion on Papenheimer body, we can do an iron stain or a pearl stain to rule out the same. Now, next is, what are the stages of reticulocyte? The stages of reticulocyte are: stage 0 has the nucleus, the nucleated RBC. We do not count them ordinarily. Stage 1, the chromatin is or the reticulum fibers are more dense, then they are slightly less denser here. Here you have multiple dots, and then you have the fine dots separated. So these are the 4 stages of reticulocytes. Next is, what are the causes of increased reticulocytes? So the causes of increased reticulocytes are hemolytic anemia, response to hematinics, and following hemorrhage. Causes of decreased reticulocyte are aplastic anemia and iron deficiency anemia. Right. Now, what is the normal reticulocyte in adults? It's 0.5 to 1.5%. Whereas if you go to newborns, the up to 2.5 to 5% is, between 2.5 to 5% is quite acceptable. So now next we will discuss about what is reticulocyte production index. Reticulocyte production index is also called as corrected reticulocyte count. Now this is a important thing in diagnosis of anemia. How do you calculate the reticulocyte production index? We calculate it as follows: the retic percentage what you get into the patient hematocrit divided by the standard hematocrit, which is 45, the whole thing divided by the correction factor. What is this correction factor? We have to understand that if the hemoglobin or the hematocrit is very low, the reticulocytes are released into the circulation with a which are very immature. So for that we have to take a correction, right? So the correction factor is as follows: for a hematocrit of 36 to 45, the survival time is 1. This is the time taken for them to become more mature. For 26 to 35 it is 1.5, 16 to 25 it is 2, 15 and below it is 2.5. So this is the correction factor we have to take into account. And reticulocyte production index greater than 3 shows a normal response to the narrow response to the anemia, whereas a reticulocyte production index of less than 2 is an inadequate response to anemia. Now there are newer methods of estimation of the reticulocyte, which can be by flow cytometry, and that will help you to even give you things such as the red hemoglobin and the mean reticulocyte volume, right? So to summarize, reticulocytes are immature red blood cells. Reticulocyte count is an important basic examination tool in the diagnosis of hemolytic anemias, and reticulocyte is done with supravital stains such as new methylene blue and brilliant cressyl blue, and it will hold its importance no matter how many ever modern tests come. And for quality control, we should do reticulocyte counting in duplicates. So you do it in one smear and then redo it in another smear. And for EQUAS programs, you have EQUAS programs in India. You have EQUAS program with AIMS hematology, where you do get a stained reticulocyte smear. All right. I hope you enjoyed the lecture. This was done using the Google Jamboard, which first time I'm using it. Do give me a feedback on this type of presentation as well, right? And please spread a word about my channel, right? Thank you again. Have a nice day.